More than 65 million Americans will soon be bombarded with ads for Medicare healthcare plans whose enrollment period begins October 15th and runs through December 7th. Each year, Medicare health and drug plans can change things like cost and coverage and what providers and pharmacists that are in their networks. During open enrollment, people with Medicare can change their health plans and prescription drug coverage for the following year to better meet their needs, whether that's dictated by healthcare changes, finances, or maybe something else. The options, though, seem endless. You can choose the federal government's original Medicare program and its drug supplements, or you could pick from a growing number, it seems like a never ending number, of new Medicare Advantage plans that are offered by private insurers yet approved by Medicare. Last year, nearly 4,000 Medicare Advantage plans were available nationwide. And according to the nonprofit company KFF, which focuses on healthcare policy, the average Medicare beneficiary could choose from over 43 of those plans, more than double the average number that were available just back in 2018. And it's the highest number since KFS has been tracking those options since 2010. No wonder, choosing a healthcare plan on Medicare can feel overwhelming and confusing. I mean, nevertheless, it's an important decision that can really hit your budget hard if you're not careful. With so much at stake, here's what you need to know. I'm going to break this down for you. Here's what you need to know to make the right decision. What the difference between original Medicare and Medicare Advantage? What is the difference, quite frankly, between Medicare and Medicare Advantage? We get that question a lot. Original, or what you may call traditional Medicare, includes Medicare Part A, which covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some other types of health care. Part B includes certain coverages by doctors, the doctor services, outpatient care, medical supplies, and all different types of preventive services that you might be come in contact with, things like MRIs, X-rays, those types of things. There's another option. There's an option that goes along with original Medicare, and that's the option to buy Part D, which is a separate prescription drug plan that you have to choose as soon as you start receiving Medicare. And if you wait, you may have to pay more, and you may get penalized for the rest of your life if you don't choose it at the right time. Access to any doctor or hospital that makes Medicare in the U.S. and usually doesn't require a referral to see a specialist is one of the main reasons a lot of people like original Medicare. There's also an option to buy supplemental coverage called Medigap, sometimes you'll hear that term, from a private insurer within 6 months of having Medicare Part B. If you're 65 or older, this coverage helps pay your out-of-pocket costs. For instance, original Medicare has a 20% coinsurance. The supplement is a one-time enrollment, and if you don't buy it inside this 6-month window of when you're eligible for it, you might not be able to buy it, or if you do get it later, it may cost you more. It takes care of a lot of those gaps in the original Medicare system. That's why it's called Medigap insurance. Then there's Medicare Advantage, sometimes known as Part C. And what the private insurers have done is they've bundled together all the things that are included in Part A, Part B, and they usually also include Part D. But a lot of times, and most of the time, you have to utilize the doctors that are in the plan's network. Plans may have lower out-of-pocket costs than original Medicare, and sometimes they offer additional benefits that original Medicare doesn't cover, like vision or hearing or dental services. They may also offer some additional non-emergency coverages that are also out of network, but typically you have to pay a higher rate if you go outside of their network, but not always. Oftentimes you do have to get a referral if you want to go see a specialist, and some people don't particularly like that, and so they opt for the other types of coverages. What is Medicare open enrollment, though? I mean, if you're satisfied with your health care plan, you don't really need to do anything. You'll automatically be re-enrolled for the next year as long as that particular plan is offered. Only about 1/3 of Medicare beneficiaries compare plans each year during an open enrollment, but there are a lot of changes this year and some plans are no longer available. So we do encourage you to sit down with an advisor and review your coverages, because plans often change, especially drug coverages, and you may end up paying a lot more than what you realize. It doesn't hurt to take a look to see what other plans have. And we certainly recommend that here at Market Medicare Advisors. The worst thing to do, quite frankly, is to ignore it and don't do anything. How do you know if you should change your Medicare plan? Well, to determine if you should switch plans, experts say you need to review what you have and determine if it still suits you. There's three main things that you should review because they often change. Number one, as I mentioned before, is drugs. Know what drugs you're taking, know the dosages, and whether they're branded or generic. See, if your plan will still cover them, you want to see if your new plan will still cover them, quite frankly, and how much they cost. Number two you need to review is doctors. If you're in an Advantage plan, make sure your doctors are still in your network. I had a meeting yesterday with a woman whose doctors were no longer in her network, but she wanted to keep her doctor, so we had to find a new plan. This isn't necessary for traditional Medicare or original Medicare, because almost all doctors accept Medicare. However, not all doctors have room for new Medicare patients, so you do need to check that out. And the last thing you need to check is you need to check your premiums and your out-of-pocket maximums, because just because it says zero premium doesn't mean there's zero cost. Everybody is responsible for the Part B premium, which is going up in 2024, and we'll have more about that in another video. Just because a supplement or pardon me, an Advantage program looks like it's lower on the surface doesn't necessarily it is when you consider the out-of-pocket maximums, the co-pays, all the things that are associated with it. So it makes sense to sit down on a one-on-one consultation. Remember, zero premium does not mean zero cost. And a lot of people get caught up in that, and ultimately they end up having a problem at the end of the year. Another thing to review also is, what is your income? Has your income changed significantly? Has it went up? You could get hit with a income related adjustment. Has it went down? You may be eligible for some state assistance or some other federal programs. So we certainly encourage you from October 15th to December 7th, during our annual enrollment period, to give us a call here at Market Medicare Advisors at 316-252-8707. That's 316-252-8707. Or as always, you can go to our website at marketmedicareadvisors.com. And you can request an appointment there. You can ask questions, and we'd be happy to help you any way you can. And always, you can come back to our Facebook page to get additional information. You can drop a comment. You can request somebody contact you. We're here to help and assist you in any way you can. Don't get left behind. Don't put your head in the sand and do nothing and hope that everything is going to be the same, because I can tell you right now, things are not going to be the same 100%. Part B coverage or premiums are going up. Medicare Advantage programs are consolidating, and there's new ones coming out, and you really owe it to yourself to sit down with somebody from our department and make sure that you have all the information you need to make the best healthcare and wealth care choices for you and your family. Thanks a lot. You have a great day. Market Medicare Advisors, 252-8707.